Join us now, Congressman Eric Cantor, Minority Whip, member of the Ways and Means Committee, and our guest host, Congressman Ed Towns, Chairman of the Committee on Oversight and Government Reform. Get to you in a second, Chairman. But Eric, you're going to be here, Congressman, for just this segment. We're talking off camera about what is it going to be Friday? Well,
you know, I think they're trying to work as quickly as possible. And, Joe, if they had the votes, we'd be voting today.
Is that possible to do? Don't they need to do something with the CBO again? Or isn't there something? There is a way to do it that would mean they do something today and then it ends up on Friday. Right?
Well, they could. I mean, they've certainly got to weigh all the costs with all the sort of arrangements they're going to have to strike with some of their members. I mean, but let's take a step back and say, you know, it's pretty amazing that we are where we are today in March of 2010. You know, this is a bill that 6 out of 10 Americans says that we don't want. Clearly, there's a significant number of Democratic members who don't want to vote for the bill. And that's why you're hearing about Speaker Pelosi attempting to use what they're now calling the slaughter solution, where they're essentially going to, I would say, bend the rules and deem the Senate bill passed, essentially confusing the public as to what this vote means.
Yeah, McConnell has a piece in the Journal today, an op-ed piece that says it's not going to be possible to do that slaughter. I mean, that's his take on it constitutionally.
Well, there's a question about whether it really is an up or down vote or not. You know, the House has done it before, where you pass a rule and then deem another measure passed, which is what they're trying to do. Again, it is trying to essentially say we're not really voting on this 2,000-plus health care bill because we're really trying to vote on this reconciliation piece. And again, it all goes back to the fact that this is an enormous bill that's going to change health care forever for every American, and the people have just said no.
Although that depends on which poll you're looking at and how the questions are asked, depending on whether people want health care reform or not.
Yeah, but they'll ask, do you think whether someone with pre-existing conditions should be covered? Of course, sure. they're gonna say yes.
But all the questions, there are loaded questions on both sides. Every question I've seen, and it's hard to even know what's in this bill at this point.
Right.
But I think more and more now that people begin to realize that the bill itself is not perfect. It's not a perfect bill at this point. And they recognize when you look, Social Security was not perfect when they passed it. They continue to work on it. Medicare was not perfect. They continue to work on it. And I think that most of the members now are beginning to realize that let's pass this, let's continue to work on it. We cannot allow 46 million people to continue to walk around with no health insurance. And I think that's where we are, and I do believe we're going to pass it.
Why isn't more being done on the cost side, though? I mean, the idea of insuring everyone is a great idea, but there are two massive problems with health care right now. The other one is, how do you pay for that?
Well, you know, I think that we still, you know, it's not a done deal yet. And as indicated, when this happens, you know, we can continue to work on it. But the point is that the numbers still are not in yet. So the CBO, we're waiting to get the final on that as well, because we don't know what the final bill is going to look like.
Yeah, but from everything that the CBO has scored, it's based on 6 years of spending on this and 10 years where you change the cost curve going out. The stuff doesn't add up.
It's hard to imagine that you add an entitlement of, as you said, 46 million people, and that it's not, the costs are going to go down. That's a tough argument to make, isn't it?
It's a tough argument to make, but when you look at what's going on, though, with health care, when you look at the fact that pre-existing conditions in terms of insurance, the portability issue, when you look at all these things, we just can't continue to allow this to just happen.
Right, and but that's not what you're proposing anyway.
No, absolutely not, Joe. And I think Ed knows all of us, Republicans and Democrats alike, want to affect reform.
It's like asking the question to the American public, do you agree with health care reform? And they get a 60% yes answer, and they point to 60% of people want this bill. That's not the same thing.
The question is it going to be economically sustainable? Or are we going to have to incur a cost as a society ongoing that's going to increase the size of government and, frankly, take away from the ability for us to return back to the priority issue right now, which is how we're getting people back to work in this country and create jobs.
I think the 85% that have insurance are worried, A, that their premiums are going to go up under this, and B, that their level of care is going to go down. I don't think there's any doubt that the public, you know, I know that the individual parts, they say that, but Massachusetts, for a while, people seem to look at that result and say, wow, there's something going on out there. But
now it's all kinds of problems, and there are new fees that are going up, and it's not going to be able to be paid for. If you look at Massachusetts right now, they are 2 or 3 years away from some very serious problems coming up with it.
Well, you know, it's interesting at this point in this discussion, because when you look at what happened with Social Security, the discussion in terms of in the Congress at
we got
the
to
time,
fix that too.
Yeah, we still have to work on it. I mean, but the point is that if you don't put something there to work on, then 10 years from now, 15 years from now, we'll still have the same conversation. So I think it's important that we move forward and fix it as we move. I mean, no question about it. I'm not sitting and saying that is a perfect bill, a perfect piece of legislation, but I do think that we would make a mistake not to move forward.
So there's 3. The margin was 5 first time around. Was that it?
Right. Well,
and then you lost, and then the Democrats lost 3. But now you're talking. You got Stupak and his guys on one side, and then who else? Who's the other group that they need to?
Well,
get?
there is all kinds of sort of reticence now on the part of most moderate Democrats as to whether they can really vote for this bill right now.
Will they be walking the plank, Congressman? I mean, there are some that got elected in red states because of the Iraq War, whatever it was, Bush fatigue. There are a lot of guys that haven't been there long that are worried they're going to be walking the plank. Should they do that for Speaker Pelosi?
I don't think it's walking the plank. I
Really?
think that it's looking to see what needs to be done. What I've found in the House, that people who did not want to support it initially now realize how important it is. So there's been a change as we move forward. Yes, you're right. We've lost some members. Murtha, who voted for it, passed away. Of course, Wexler, who voted for it, is no longer in the Congress. There's no question about that. And, of course, the gentleman from Louisiana, Kyle, who voted for it, I understand now is not going to vote for it. So there is those problems. But the point is that I really feel that members now understand more about how important it is to do this now and not to delay it.
Maybe you would be going against your president as a Democrat, Eric. Do you think they're willing to do that just to stay in the House?
Joe, I think, again, the reason why we're here without the vote having taken already is because the people at home don't like this bill. And it's really not a question of whether we're going to do health care reform or not. It's the way this bill accomplishes it that people don't like. And sure, everything in the bill on its face, perhaps getting rid of pre-existing condition, denial, etc., is a good thing, something we need to work towards, but we can't afford this bill. And the way that it's done just pretty much ignores trying to bend the cost curve so we can see more people have health care in the long run. That's our point. We've always said, look, we've got other ways to do this. We can take a much more common sense approach to health care reform to actually begin to bring down costs.
There was going to be a hailstorm. I was going to use another word, but you can't, even though it's cable. But there's going to be a hailstorm either way. If the president waits around for this and doesn't go on his Indonesia trip, and then it doesn't come Friday, or if it goes down Friday, that's going to be horrific to watch. That's drama. And then if it does happen, I mean, the Tea Party types, they're going to go crazy, Congressman, aren't they?
Well, you expect that kind of reaction.
Not even just the Tea Party. I mean, people think that they're far out on the right, but just even independent voters might have a problem.
Well,
if it's railroaded through like that.
But when you think about 46 million people,
I know.
Think about that. And I really feel that more and more people are now beginning to realize something needs to be done. And, of course, I do believe that on Friday it will happen.
Well, Joe, we'll see. Again, I think that if this bill passes, what people will begin to realize is the enormous consequences of the cost of this bill, together with everything else going on right now. While we're trying to focus on getting people back to work, the more we see money concentrated in Washington, the less ability for the private sector to grow and create jobs.
You guys are not going to agree today. I mean, I can just see that I'm not going to get you guys to both say the same thing here. It's not. I can't. It's not going to happen, Chairman, is it?
Because he's saying the wrong. He's saying the wrong.
I can't. This is a problem. I see a difference of opinion here. Is that
the wrong thing?
Is this happening down in Washington?
You think?
And then I can't. I figure with my powers of persuasion, I was going to be able to do so. Or at least you. Maybe Carl. Maybe if Carl were here, we could have known. All right. Congressman, it's good to see you.
Joe, nice to meet you.
All right, we'll see you again soon.